Therapy, it goes hand in hand with myofascial release. The fascia is more full body, and the craniosacral is more working with the membranes that surround your brain and spinal cord. So here we have Fred, and you can see how connected from the head to the tailbone you are. So if this is tight here or twisted in your tailbone, it's going to impact all the way up into your head and your brain and pull on the membranes that are impacting your brain. So we work both with the cranial bones and with the sacrum and influence the entire dural tube. And as you can see, my peripheral nerves here, all of these peripheral nerves can also be caught or tight in a restricted dural tube. So that can impact and cause tightness, spasticity, or into any muscle that these peripheral nerves go to. In addition, we have membranes in our brain that transect the brain from front to back and from side to side. So as we're working on the cranial bones, which are mobile, they're not fused as traditionally thought previously, but we can actually pull on the bones, which will pull on the dura, and that will pull right through the brain. And as you can imagine, if there's a restriction in any of these membranes here, which also house your ventricles are in here, this is where your spinal cord would come in, but any restrictions here could cause migraines or spasticity or memory loss or dementia or any of those things. And if we really increase the fluidity here and make sure that they're nice and loose, we're going to make sure that we're feeding our brain so there's no restrictions that are inhibiting nutrition from getting into different areas of the brain as well. Not to mention, your pituitary gland is housed in your sphenoid bone. There's your sphenoid here right at the base of your bone. So if that gets stuck and it doesn't rock properly, the pituitary doesn't function properly, which is the driving force of all the hormones in your body.
Metabolism, guys.
Yes, that is going to be a big impact on your metabolism. So we really want to make sure that these bones are functioning properly and moving properly for the entire central and peripheral nervous system, and then also for your entire hormonal system throughout your entire body.
Wow, that's crazy that this manual type therapies just even exist to help with, I mean, all kinds of things.
Right.
What would you say, because I know you did mention migraines, and I know you see a lot of women. What are some common things that you see in your practice?
Oh, with migraines, very often the cranial base is very tight and restricted, and as you can see, that's where your spinal cord would come in right here. And if your cranial base is tight because you hold your tension in your shoulders and up in through your jaw, that's going to severely restrict these bones, and then you're going to have the poor circulation. So once we get in there and we start loosening up the cranial base, it's really amazing how all of the muscles in the neck and shoulders start to release. And I also go in and I work inside the mouth as well. And I've just had such great results, even working on teeth. That I have one lady who's very hunched forward, and she felt like as I was working on each tooth, that her head was going back further and further, and she was straightening up, and when she got off the table she was much straighter than when she had gotten on the table. So even like anybody who has had braces, it's amazing how that can impact through the mouth down to the jaw and into your neck, and cause headaches and also cause postural abnormalities.
Absolutely. And I'm sure, and of course for the dentist too, so much of that and mouth integrity, I'll say, and what you're explaining can make huge impacts. I work with a lot of dentists because of course sleep apnea, right? So you have inflammation from abscess. So if we start to see someone's metabolism or inflammation continuing to climb and we've checked all the bases, it usually comes down to this person had like a gnarly abscess going on. But with structures such as braces, me personally, I had to have the crinker and expand my jaw. Yeah, that was really fun. But during now growing up, and being an adult now, I was, in my adolescence, changes just in, like, back then in my athletics. I mean, I witnessed it without really knowing anything about it, and my orthodontist would try to educate me on this, and then I ended up working for my orthodontist, so I ended up becoming an assistant and working inside people's mouths. So that was one of the first actual, like, clinical jobs that I had. But and that's, how I work too integratedly, is some of these things, like how you were just describing, we never think about.
Right.
When would a woman ever think with her migraines or anything of that nature, right, to come and have someone massage the inside of my mouth? I mean, it's more than a massage,
Right.
but, a specific technique to help, like you said, loosen and allow.
Yeah, and so often it's coupled with TMJ. Oh, I have migraines, and nobody puts it together. Well, there's probably a common denominator there between your TMJ and your migraines as well.
Right, yeah. So what are some other women that you work with outside of migraines, like typical pain, injuries? What do you see a lot of?
I see a lot of orthopedic, but also I treat just women central diagnoses like fibromyalgia, lupus, chronic fatigue syndrome. This works so well with syndromes like that. Autism is really good. I know that's not quite on the women's spectrum. I also do women's health issues, so great results, women and men, with especially as you get older, that urgency, having to get up 3-4 times at night, and that, I mean, I don't do internal work on men, but I do external work on the bladder, and most of the patients, they go from, in one session, I'm up 4 times a night to I'm up once a night, to then they can sleep through the night after about 2 or 3 sessions, which is great. But then the internal work also on a woman helps with, I'm sorry, what is it when your organs drop? Prolapse.
Oh, the prolapse.
Yeah, it helps with uterine prolapse, bladder prolapse, in conjunction with exercises that help to strengthen, and not just Kegels. You have to make sure if you have prolapse, you don't just do Kegels. Some people, Kegels, it's counterindicated if you happen to be hypertonic.
Too tight.
Yeah.
So that, correct. And then, and of course, that's where my end comes in too, is everyone's like, well, I need to get tight and I need to do more Kegels. And that's, I think too, so traditional and common and what's been conditioned. So women like us and other professionals out there, I forgot where we were going back, so I'll have to edit this part out. But what was the original?
Internal work.
Internal work, right. Oh, with the Kegels is not being so tight and working on just the Kegels. Is sometimes we think that what we're doing is helping,
and it's making the situation
and it's
worse.
conjugating, making the situation worse. And I learned that too. So me, I have women do specific exercises to not just strengthen all the pelvic area, but also help loosen and stretch it. But sometimes you do need manipulation. Sometimes it's more than just stretching, guys. It's more than just the exercise, and it's more than obviously providing the healthy nutrition. Sometimes, and I would say especially now with patterns and trends, and we've all lived a good part of life now, it's going to take a little bit more.
Yeah, and it's just soft tissue too. That is muscles, inside, internal. So just the same way we work the muscles externally on the outside, we can get in there and work the muscles internally, and even get on things like your sacrum from the inside and work the soft tissue covering your sacrum, and positioning the sacrum on the SI joint and the lumbars as well, the L5 and stuff like that. You can kind of get.
So my personal, I had two C-sections. So I've never, I went into full delivery and all of that, but never actually got to push them out. They've gotten cut out. But with that, I will tell you each time, and they try to get you to go to the bathroom, right? Mm-hmm. Right before you leave the hospital, and that's like priority 1. And I remember it was my second C-section, and with my daughter, and it was that first, going to the bathroom, and I was crying. I was so scared because I knew I had to pee. I could feel it, but I couldn't
Control
do
the
it.
muscles. Yeah.
There was no, it was just as if it did not exist. And I remember after my son, just things such as jumping, like plyometric exercises, skipping, I still have to really think about it. It's just a lot, you know, since you've been sliced and diced. But yeah, after my daughter, it was a little traumatizing. But the nurse was like, "It's gonna come back. Like, you'll be okay. We'll try again in a few minutes." And I was like, "Oh no, you cut all my nerves and you know, everything. Is that it?" And she's like, "It's gonna come back. It's gonna come back." But now obviously it did come back. I don't, you know, have much issues as far as like I'll pee myself or anything. But I do have to, if I feel it,
Use the bathroom.
I have to use the bathroom. There's no holding. But my husband has, you know, brought to light to me that I'm on like a 45-minute-hour schedule.
Wow.
And when I drive, now again, we go into I'm hydrated, all of this, right? But your body should adapt
Right.
to those fluid intakes as long as I'm consistent with it. So I really don't think that, you know, it's my fluid intake always changing, because I'll be like, oh, don't chug all this water right before bed, right? And sure enough, when I travel, I've just come to find throughout time, my husband's right. It's about 45 minutes to an hour.
Wow.
And then after meeting with you and Denise telling me, you know, about you and everything, and I have been thinking about this, and I'm like, I remember the story in the hospital where I really never gained that
Fully back.
Yeah.
And the scar tissue keeps growing. If it's left untreated, it will continue to grow and continue to restrict and cause issues throughout your entire pelvic area.
Yeah.
So the dolphin can also be used to stimulate your vagal nerve to increase your parasympathetic nervous system and decrease your fight or flight. And your vagal nerve, it just impacts so many systems in your body. It has both a sensory component and a motor component, and it impacts your digestive system and your pharynx and larynx and your ability to speak and swallow, and also anxiety. And it's been used. They just changed this since COVID. They now have a protocol that you can use this for COVID long haul clients to recover from the long haul effects of COVID.
So post-virus.
Post-virus, yes. If you've had it and you recovered from the virus, it's no longer in your system, but you still have the symptoms, you still have the fatigue, you still have the brain fog. I've had some clients that the brain fog has lifted in one session and gone completely away in two, and they were able to function in their jobs again after just 2 sessions of having just 15 minutes of having your vagal nerve stimulated and reset, basically.
So this is something I specialize in, is post-viral infections. Doesn't have to be COVID. Before I work with oh my God, what is it? Polio.
Oh,
I work with many polio patients. So I was still recovering and rehabbing a lot of patients that were affected from polio. And other post-virals. So again, this was way before COVID, when I was practicing in the hospital. Women, people from other countries that contract viruses, and they now have severe heart conditions and heart disease, lung disease, you name it, GI issues. A woman that I worked with that kissed the block in Ireland, you know?
Oh,
yes, so
wow.
all many types of viruses, and understanding, you know, the pathophysiology of that. Inflammation climbs and does take over those nerve endings, right, and all of that. So again, really neat in my field, being able to understand that and help my clients be educated on that. But now what tools are out there for that? So yes, I can create an entire wellness program to help that body and individual post-virus. My Down syndrome patient is one of my newest stories that I've been telling. So being able to work with someone like that, and then now be able to use resources like you to pull that in and complete
right
someone's overall complete wellness and well-being. So that is really neat on a post-virus standpoint, but also, I mean, just in so many ways, when you were saying the parasympathetic system, the GI, and you were listing all of those.
Heart, lung, liver, everything is impacted by the vagal nerve in particular.
So I do a lot of education on this because, you know, a physician may come to me and be like, well, we need this person to exercise or do this specifically for a surgery or post-surgery, right? Or they need to lose weight to qualify for surgery, whatever that picture may look like. The physician, you know, gives me this order, and after I come and find out, it's like, well, their adrenal fatigue or their parasympathetic, their fight or flight is severely off, their anxiety, their GI, and you can literally connect like you do. You just connect these dots once you've been in the field long enough, practicing long enough. And it's like, well, I can't tell that person who's already chronically inflamed to go exercise and do all of this stuff, because it's only going to keep compounding what they're actually trying to treat.
Right.
So let's go back to step one. And with that assessment that I do too is, okay, there's some parasympathetic imbalances, if you will, going on here. You know, we need to tackle this first. This is, you know, some X, Y's, and Z's of some things you're experiencing, and then the light bulb, you probably see it, right? That light bulb goes off in the patient's head, and then you're like, now I got him, you know? So I provide so much education and know-how on that, but I'm obviously just one person. So now it's, here's the information, now what can you do about it?
Right.
So these are tools that
you can use to treat it.
And local in Florida is Miss Dr. Kathy. Is it Dr. Kathy Hennessy?
It is.
Yeah. Okay. So she's right here in Lutz, Land O'Lakes, Florida.